the website initially directed me to a test centre in Basingstoke that I know isn't there and had actually been closed down some weeks ago.
Every time I went on, the message said, tests not available, or wait a few hours and try again.
The nearest testing centre with available appointments was 92 miles away.
I'm a healthcare professional trying to get back to work. I've been told I can't go back unless I get a negative result. There are no home tests available.
A testing system under strain, but why? The Health Secretary blamed people getting tested.
In the last couple of weeks, we have seen an increase in demand, including an increase in demand from people who are not eligible for tests, people who don't have symptoms.
Officials have also said there are problems with lab processing. Whatever the reason, testing has become a struggle.
Looking at this testing centre in South London, you would never guess there was intense demand for tests. I mean, look at it. It is quiet. But weirdly, that's exactly what the government wants. It's artificially restricting the supply of tests to push testing capacity away from places like this towards other parts of the country. And that's why, if you try and book a test in this area right now, you're told that despite this emptiness, there's nothing available.
That might make sense nationally. To frustrated parents, it feels like the signs haven't been clear. Steve drove 2 ill children to a testing centre only to be turned away.
People don't drive for hours on end to shove cotton buds up their nose and into the back of their mouths for fun. They're doing this because they're scared and because there isn't a clarity of message coming from government.
It's in this context that the Prime Minister announced a bold new plan for mass testing, suggesting people could get a test before going to the panto or the office. Even if the technology comes through, experts are doubtful about its merits.
I think it's possible, but actually I would almost question whether it's desirable. And actually I think it comes back to this: we don't have a coherent strategy about how we're doing to try and tackle this disease. And we seem just to be throwing numbers and sound bites and quotes at it. We get a bit frustrated at that, because what we want is a coherent testing strategy to deal with what we are facing at the moment.
With cases rising fast, the government sees testing as one of its most important tools. Trouble is, right now, everything is going slow. Roland Manthorpe, Sky News.